Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Achilles Tendon Rupture. Introduction. The Achilles tendon is a strong cord that connects the muscles of the calf to the heel bone. When the tendon is completely torn, it is called an Achilles tendon rupture. Achilles tendon ruptures are painful. They can severely limit your ability to walk, run, or jump. Surgery is usually needed to treat the condition. This program explains Achilles tendon rupture. It talks about the symptoms and causes of the injury. It also discusses how the injury is diagnosed and treated. Anatomy. The ankle is a large joint. It connects the foot to the lower leg. It also lets the foot move up and down. The subtalar joint sits below the ankle joint. It allows the foot to move side to side. Many ligaments surround the ankle and subtalar joints. Ligaments are tough tissues that connect the bones. Ligaments support joints and keep them in place. Muscles and tendons help the ankle move. Muscles are made of a stretchy, elastic tissue. Small fibers make up each muscle. Tendons are tough cords of tissue. They attach muscles to bones. They help your muscles move your bones by pushing or pulling the bones in different ways. The Achilles tendon is a large rope-like tendon in the back of the ankle. It connects the muscles of the calf to the heel bone. The Achilles tendon is also called the tendon calcaneus or heel cord. When the muscles in the calf contract, the Achilles tendon tightens and pulls the heel. This lets the foot move down. When the muscles relax, the foot moves up. This movement allows you to walk and jump. An Achilles tendon rupture is a complete tear through the Achilles tendon. It usually happens about 2 inches above the heel bone. It can be painful and can limit your ability to walk, run, or jump. Symptoms. The most common symptom of an Achilles tendon rupture is sudden severe pain. This pain is usually just above the heel bone. You may hear a loud popping or snapping sound when the injury happens. An Achilles tendon rupture often causes swelling and bruising around the ankle, leg, and foot. Sometimes a small dip or gap may be seen above the ankle. An Achilles tendon rupture can prevent you from doing your usual daily activities. The condition can make it hard to walk, run, or jump. Rarely, an Achilles tendon rupture can happen without any symptoms. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Achilles tendon ruptures are usually caused by sudden stress on the Achilles tendon. This stress can happen from playing a sport that requires intense movement, falling or tripping, stepping into a hole or off a curb. As you age, the Achilles tendon can become weak and thin. This makes it more likely to rupture the tendon with increased activity. Certain diseases and medications also can make a rupture to the Achilles tendon more likely. Anyone can rupture their Achilles tendon, but the injury is more common in men than in women. Diagnosis. Your healthcare provider will ask about your medical history. He or she will perform a physical exam. Your healthcare provider will examine the affected ankle. He or she may be able to feel a gap in your tendon if it is ruptured. If your healthcare provider cannot diagnose a rupture from a physical exam, he or she may order an MRI scan. An MRI scan uses a powerful magnet linked to a computer to create detailed pictures of the inside of your body. Treatment. An Achilles tendon rupture is often treated with surgery. During the procedure, an incision is made in the back of your leg. The surgeon then stitches the torn tendon together. An Achilles tendon rupture sometimes can be treated without surgery. You will be given a cast or boot to raise your heel and let your tendon heal on its own. But without surgery, the risk of having another rupture is higher. Physical therapy is used to regain strength in the tendon and leg. You will learn exercises to help increase your mobility. The tendon usually heals within 4 to 6 months. Prevention. Stretch your calf muscles before exercising or playing sports. Stretching can help make stress on the Achilles tendon less sudden. This can prevent an Achilles tendon rupture. If you are running, try to avoid slippery or uneven surfaces. Wear shoes that are comfortable and that provide heel support. It is important to avoid increasing your level of training abruptly. If you are not used to high levels of activity, try to increase your training slowly to avoid injury. Alternate your form of exercise daily to avoid too much stress on your Achilles tendon.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The Achilles tendon is a strong cord that connects the muscles of the calf to the heel bone. When the tendon is completely torn, it is called an Achilles tendon rupture. The most common symptom of an Achilles tendon rupture is sudden, severe pain. This pain is usually just above the heel bone. You may hear a loud popping or snapping sound when the injury happens. An Achilles tendon rupture often causes swelling and bruising around the ankle, leg, and foot. Achilles tendon ruptures are usually caused by sudden stress on the Achilles tendon. This stress can happen from playing a sport that requires intense movement, falling or tripping, stepping into a hole or off a curb. An Achilles tendon rupture is often treated with surgery. During the procedure, an incision is made in the back of your leg. The surgeon then stitches the torn tendon together. Stretching before exercise, running on even surfaces, and increasing your level of training slowly can help prevent an Achilles tendon rupture.
Thank you for using Explain.